My name's Kate. I'm the nurse manager of the Nursing and Midwifery Workforce Unit here at Canberra Hospital. I'm meant to be joined by my colleague Victoria, but she's off sick today, so it's just going to be me talking to you guys. I'm so sorry about that. We've prepared a little webinar for you just to talk about Canberra, what we're looking for, and sort of what we have to offer. So we might jump into it, and then as Lara said, at the end there's always time for questions, and just have a bit more of a chat. We're also joined by Kelly Lang, who's our executive director, so any questions we're happy to answer. So let's just get into it. So we're here today to talk about Canberra Health Services, and in particular recruiting to our critical service building that's due to open in August this year. First, I would like to welcome you to Canberra and acknowledgement of country. So Canberra Health Services acknowledges the Ngunnawal people as traditional custodians of the ACT and recognises any other people or families with connection to the lands of the ACT and region. We acknowledge and respect their continuing culture and contribution to the life of this region. So just a little bit about Canberra Hospital. We're rolling out a new brand. We're really excited to share that with you today. You guys are the first to see it all, and it's been rolled out internationally first. So I've got a little video to show you, I guess, a quick snapshot of Canberra Health Services.
Canberra is growing, and so are we.
We're recruiting
nurses,
midwives, radiographers,
Pharmacists,
specialist surgeons,
and more
to create exceptional healthcare in Australia's happiest city.
Canberra Health Services is a place where I can have an ambitious career,
plus a relaxed lifestyle,
great salaries,
plus great teams,
education support for my career,
plus a world-class education for my children,
mandated nurse ratios,
plus you get paid to relocate.
I moved to Canberra 7 years ago.
People said to me, Canberra?
And I said, yeah, Canberra.
Canberra is
a progressive city, a surprising city,
a world-class city,
a friendly city.
It has a great community feel.
Galleries, museums and restaurants.
less traffic.
Less traffic.
Less traffic.
It takes me 10 minutes to get to work, even in peak hour. Sydney, an easy drive to the north.
Australia's best skiing to the south.
Stunning beaches, 2 hours east.
And world-leading universities right here.
Big city opportunities.
Plus a small city feel.
It's Australia's happiest city.
And that shows every day at work. And what do I love about Canberra Health Services?
My team.
My team. Our team.
Every day, I get to work with people that support me, help me grow, and make me laugh.
We have amazing work-life balance.
Canberra Health Services has supported me to do incredible things with my career.
We regularly collaborate with researchers at ANU, Australia's top research university.
We're about to make some big changes at Canberra Health Services.
We're expanding Canberra Hospital
To create
More operating theatres.
Emergency spaces, cardiac care beds,
ICU spaces,
Pediatric ICU beds,
day surgery beds,
and a future-ready health service.
Be part of the team
that transforms healthcare in Canberra.
Get your balance right.
at Canberra Health Services.
I love that video. I think it shows a really great representation of what Canberra has. All those people in the video are actual staff members, so it's really nice to see them showcasing what we have and what we can offer. So Australia's best kept secret, that is Canberra. So Canberra is the capital city of Australia. Our population is close to 400,000 people. And what's great about Canberra is that we've got the convenience of a capital city, but with a relaxed lifestyle. So as that video sort of touched on, there is definitely less traffic and an easy commute to work. Canberra's probably 40 minutes from one end to the other. We do have a little bit of peak hour traffic, but really on a general basis, it's easy to get around. Canberra has been voted as Australia's happiest city. We're the knowledge capital. We've got great access to museums, galleries, schools, universities, and great training programs at all levels. So for you and your family to come across, there's great opportunities for your children, for your spouses, and for yourself. Canberra Health Services, our motto is delivering exceptional healthcare together. So about Canberra Health Services, we offer high quality, effective person-centered care. Our vision is creating exceptional healthcare together, and we deliver a range of health services for people not only across the Australian Capital Territory, Canberra, but surrounding southern New South Wales. So we have a catchment of approximately 470,000 people. Canberra Health Services, we're broken up into 4 campuses. So Canberra Hospital, which is the main hospital and which we are recruiting to today, is our trauma services. This is our major medical and surgical services and our teaching hospital. North Canberra Hospital is our acute and subacute services. We also have a rehabilitation and geriatric unit at the University of Canberra Hospital. Clare Holland House is our public palliative care services. Canberra Hospital, Canberra Health Services, we have amazing nurse-led walk-in centres and they provide free healthcare for non-life-threatening injuries and illnesses. So anyone with your young family or with children, this is where you will be going. I have been there many times with my children and it's just a great service to be in and out without having to go to the ED or see your GP. Our community health centres, we've got general and specialist health services to people of all ages, and our community-based healthcare services such as early childhood services, youth and women's health, dental health, mental health, and alcohol and drug services. So something for everybody. So why choose us? Well, there are plenty of reasons. We've prepared a short video to show you, and this is one of my amazing colleagues and good friends, Savecha, and I'm so proud to see her in this.
I knew I wanted to work in healthcare from a very young age. I did my nursing degree in Nepal, and my first job was to train undergraduate student nurses, which is equivalent to an enrolled nurse in Australia. I came to Australia in 2011 for further study and discovered CHS when I was doing a program to become a registered nurse here. During my 12-week placement, I absolutely loved the hospital. I loved the culture, the strong sense of teamwork, and the support CHS offered to team members. I wanted to be part of that team. Unfortunately, I was offered a job and sponsorship for permanent residency. Nowadays, I'm clinical nurse educator for Nursing and Midwifery Resource Office. I've always been passionate about education and helping staff perform at their best. For me, the most rewarding aspect is witnessing novice nurses blossom into confident professionals. I usually get quite emotional during the graduation ceremony held for novice nurses. What I love about CHS is the supportive and positive environment it provides for professional growth. I've found my role models in every department I've worked in and received unwavering support from my managers and always felt valued as a team member. There's a strong focus on health and well-being of the staff, and the best part is that parking at Canberra Hospital is free. I love everything about Canberra. It's peaceful with minimal traffic and only a 30-minute drive to anywhere you need to go. The community here is welcoming and there are beautiful local cafes to enjoy. I love hiking and Canberra offers fantastic hiking spots. Canberra reminds me somewhat of Kathmandu, my hometown, but with fewer crowds. Canberra has truly become a home away from home for me. This city is safe and I love raising my kids here. I've been with CHS for 11 years now. My journey from being a nurse from overseas to becoming a clinical nurse educator has been really positive. CHS is a fantastic place to work. They value and support you, and there are lots of opportunities to learn and grow. The competitive pay, education opportunities, well-being support, and culture of learning and appreciation make it a truly special place to work. I knew
So why, oh, I think I missed a slide. Sorry, guys. No, we're good. So why work for us? As Savecha touched on there, we offer visa sponsorship. So at the moment, we're offering the 482, which is the temporary skilled shortage visa, up to a maximum of 4 years. And we're offering the permanent residency as well. We offer a very attractive relocation reimbursement package that's up to $12,000 to relocate to Canberra. And that can go towards things like your visa nomination, travel, temporary accommodation, anything that would be classed as assisting you in coming across to Canberra. We are offering 4 weeks temporary accommodation. So when you get here, you're not worried about finding somewhere to live straight away. We've got salary recognition for prior clinical experience. And something that's really exciting for Canberra Hospital is our nursing ratios. So we've introduced nurse ratios, mandated staffing skill mix. So that means that on each shift that you are working, you have a mandated amount of senior clinicians within the area to be able to support you. We also have amazing nurse to patient numbers. So in our surgical inpatient units, it's a nurse to 4 patients. So I know that's a bit different to the UK and overseas. So it's 1 nurse for 4 patients. We also have lots of support staff to be able to assist you in your clinical area. So assistants and nurses, undergraduate student nurses. So you're able to give that level of clinical care that you want to be able to do. So we're really proud of our nurse to patient numbers as well as our mandated staffing skill mix. So why work for us? Well, our enterprise bargaining agreement is leading the way in improved working conditions for nurses. This is still under current negotiation, so we're really excited to see the rollout of our new EBA in the coming months. We have excellent working conditions within a tertiary teaching hospital. We've got highly competitive pay rates and salary packaging options to support your wage. Our super is great, and we've got ongoing education and training opportunities, including scholarships for further education. So we're here today to talk about our critical services building. This is what our big recruitment is driving towards. Here's another little video to give you a snapshot of what CSB is. So the Critical Services Building, it's one of Australia's newest and most technically advanced healthcare facilities, and we will be opening in August 2024. So it is going to house the latest specialised medical equipment with a bigger emergency department, more operating rooms, more treatment spaces, and more intensive care beds. So one of those areas is going to be the emergency department. So just a quick snapshot of our ED. It's the major tertiary referral and trauma centre for the ACT and surrounding New South Wales region. We have more than 90,000 patients per year. ED typically on a Monday sees 250 presentations. Care for adults and children of all ages, and we're the designated New South Wales Role Delineation Level 6 tertiary service and trauma centre. We're also a level 4 major referral service. So the innovations that are going into the new build is that it's going to have a children's emergency medicine unit, command control and communication centre, a pre-triage nurse, rapid assessment and treatment rooms, a behavioural assessment unit, nurse practitioners and advanced practice nurses, courtyard spaces and a low stimulation room. Part of this as well is our medical emergency team, which is known as our MET team. And we've got a dedicated MET for Canberra Hospital. And so this is a rapid response and assessment and management and follow-up of review for patients that are within the hospital. It works in collaboration with nursing staff from intensive care unit and the ED, and also for our neonatal intensive care. So the rapid response model, it's got the advanced practice nurses and nurse practitioners, which we're currently recruiting to now, and rotational registered nurses. So there's lots of room for rotations through that area and career progression within the MET team. Our cardiology department is also expanding as well. And we cater for people in the ACT and surrounding New South Wales, all ages, acuity, frailty, and disability. So our acute cardiac care unit and cardiac cath lab will have new units, and we'll also have room for outpatient services. So we've got an EP lab, diagnostic room, stress test room, and automatic dispensing cabinets and bariatric rooms as well. So really excited to roll out these new innovations within our cardiology team. Our surgical inpatients units as well, they're going to be moving across to the new build, which is really exciting. So our specialties include cardiothoracic, emergency general, neurosurgery, max fax, and vascular surgery. So with this, we're going to have streamlined patient pathways through the critical services into the inpatient units. Our leadership team supports clinicians through effective communication, clinical expertise, role modelling, and a real commitment to excellence. So again, we've got the bariatric room, a multi-therapy space, which is great for our rehabilitation, and a procedure room, all within the new surgical inpatient units. Our perioperative services is growing as well. So we're going to go to 22 theatres. So we're going to have streamlining for patients with disability and or sensory considerations, fully integrated units with perioperative services, intra-op and post-op services, and a dedicated neurostimulation therapy suite. So it's really exciting. We're going to have digital operating theatres, hybrid operating theatres, interventional radiology theatres. We're going to be doing cardiac surgery perfusions and anatomical pathology. It's going to be a command centre and a perioperative patient flow and patient pickup lounge as well. So looking at people that are just here for the day surgery procedures. Our ICU is growing as well. So we've got the management and monitoring of patients with life-threatening illness, injuries and complications. On average, we see 2,400 patients per year. And we've got specialised facilities for the support of vital organ function. What's really exciting about this ICU that's coming across to the new build is the outdoor terraces, being able to take patients outside for fresh air. Is something that we're really excited about. We've also got the therapy gym over there, again for rehab, so it's sort of covering all the bases. Medical imaging is expanding as well. It's going to be operating 24 hours a day, 365 days a year. We're going to be able to provide timely access, best turnaround time in the region, access to procedures under general anaesthetic and sedation if needed, and specialisation in areas such as paediatric imaging, cardiac imaging, and breast imaging. We'll have the hybrid theatres, the hot theatres, and intraoperative medical imaging as well. So, what's next? Would you love to join us? We would love to have you here. And we're working towards this big recruitment campaign to be able to meet as many of you as possible. That's the end. Is there any questions from everybody? Is there anything else that you guys wanted to know? We're really excited. Myself and our Director of Nursing will be coming across to New Zealand next week, which is coming up really quickly. And then we're flying to Dublin in the UK from the 19th of March. So we'll be there in person to hold the interviews. and get to know you as well.
Is there an age restriction?
I have a question.
If everyone can just pop their questions into the chat and then we can just read them out one at a time. So we do have one question, Kate. Just wanted to know if there's any scope for robotics in the new building.
Oh, I think we're developing that. Kelly, did you want to jump in?
Yes, I know that there are a few specialties that are working in that space at that particular point. I know particularly urology, and I think there's a few other innovations within general surgery. I'm not 100% sure, but I know that those areas are actually working in that space at the moment.
Hi, my name is Donna. I have a question.
Go for it.
Yeah, I work in respiratory medicine here. So do I have any opportunities over there? Like if I come for the interview, like my specialty is respiratory medicine.
We're really looking for nurses to come across to the critical services buildings. So that includes the ICU, the ED, perioperative services, the cardiology department, and some of the inpatient ones. So that's what we're looking for at the moment, and that's what we're recruiting to.
Okay, thank you.
Hi, I have a question.
Yes.
I am working in New Zealand in a critical care. So, when is the interview in New Zealand and how I can attend the interview?
Sure, Lara.
If you can just reach out to your recruiter, we'll give you all that information after the presentation.
Okay.
Any questions regarding the actual interview with venue details or face-to-face, just, reach out to the recruiter and we'll assist with that. Is the question, is there any scope for orthopedic surgery?
Yes, we have a large orthopedic, we have 2 orthopedic units here and do a lot of day cases, emergency trauma with orthopedics. So yes, there's definitely scope.
We are actually the only trauma hospital between Melbourne and Sydney. So, there's about 8 hours drive between Melbourne and Sydney, and so we're in the middle of that. So we do receive a lot of trauma through this organisation. We actually receive a lot of different things that in other metropolitan hospitals they may well go elsewhere, but we are sort of really the central, given the fact that we are the only trauma hospital between Sydney and Melbourne. We get a vast variety of activity.
Is there a choice between 8 hours and 12-hour shifts in the ICU?
Yes, there is, and that's something that you can discuss with the clinical manager, but yes, there is.
Next question.
My name is Lakshmi. I have a question that if we are successful for this interview, when will be the expected date of joining?
Yeah, great question. We want everyone over here as soon as possible. So we do understand that the visa process, if that's what you need to go through, can take some time, but we're aiming to have everyone here by May at the latest, May, June.
Okay, and I have one more concern that I am currently working in New Zealand and my English testing score will be expire on the June. So if your joining date will be exceed over that, whether that will cause any problem?
Sorry, I didn't catch that.
My English test score will expire on June of this year, and your joining date will exceed like August, like that, whether it will cause any problem?
Look, we expect that everyone has APRA registration. If you're looking for the 186, have ANMAC and the English test completed and have full working rights to come across to Australia. So if you've got any of those considerations, I suggest that you reach out to your recruiter to discuss that.
Okay, thank you.
I understand in particular on the I don't cover my ID, but with the letter for.
Sorry, Sonny, you're breaking up quite a bit. Can you just write the question in the chat and we'll just call it out?
Yeah.
Thank you. Kate, there's another question. Do you specialise in ECMO services?
ECMO?
Yes. She
Yes.
comes from advanced care. Yeah.
Yeah. So within our ICU.
Do you have a gastro unit?
We do, but we're not currently recruiting to that area through this recruitment activity.
So I'm just reading through some of this question.
Sorry, I have a question. Is there an age restriction?
It's dependent on your visa restriction.
Okay, and what is the criteria? Because I'm almost 52.
Yeah, you'd have to talk to a migration. We can't really advise on anything that's related to the visa.
Okay.
So the working hours, yes, I can talk to the working hours if you like. So generally, we do 2 8-hour shifts during the day, 8.5 hours. So it's a 7 o'clock start and you finish at 3:30 in the afternoon, and that's classed as a morning shift. An evening shift will start at 1 o'clock and go through till 9:30, and that's your evening shift. And then night duty is your 10.5 hours, and that will go from 9 o'clock at night till 7:30 the next morning. Some of our critical areas do run on 12-hour shifts. And I know the ED does have different start times, but generally we stick to the 8, 8, and 10. Some of these areas will be looking at having on-call, especially within the cardiology department, the cardiac cath lab. So you'll be on call and coming in if required. But again, that's something that you would discuss with your clinical manager when you start. Theatre's hours are a little bit different as well. They do have the morning shift. They'll have a through shift, which is pretty much a day shift, and then an evening, and again on call overnight.
Great. There's another question. Do you sponsor for postgraduate courses for critical care?
We do offer great scholarship opportunities, and that's something that you can explore once you start. So we do have many scholarship pathways that are open to employees that you apply for, that you're given grants for. We've also got a great in-house education and training program. So there's lots of courses that you can either do face-to-face or online.
I'm a nurse working in a maternity postnatal unit. Is there any opportunity for nurses in maternity?
We would definitely explore that. So we would have a look at your CV and see what your skills and clinical experience is. So just send that through. Do you provide work in Sydney? No, we don't. We're looking at Canberra. Sydney is 3 hours north from us.
If you've got questions regarding NMAC or the visas, just reach out to your recruiter, please, as well.
It is a requirement for people that are seeking 186 to have your AMAC completed. Because we're on such a strict timeline, we need to have that confirmed and ticked off before we're able to progress.
Any opportunities for urology or dialysis?
We're not urology as one of our surgical units. We could definitely explore. We're not looking at the dialysis unit at this time.
Kate, there's another question around cardiovascular surgical ICU experience, and yes, there is vacancy.
Definitely.
Because
That's
we do
something
all
we're
of that work as part of our ICU.
Definitely. We're definitely recruiting into that area, and that skill set is something that we are looking for.
Hi, I have past experience in cardiac ICU from 2014 to 2018 as a team leader, but currently I'm working in general medicine in UK. My code is medical. Can I apply for critical care?
We would really want recency of practice, just to ensure that you're up to date with all procedures, policies. But definitely send your CV through. That's something that we can have a look at with our team. As part of the process for this recruitment activity, we receive all your CVs. We have a look at them and then we go to the clinical managers to go through it with them. So the managers from ICU, the managers from ED are reviewing all the CVs and looking at which skill set would best suit their area. We do have vacancies in the surgical wards, and that's part of our recruitment. Any other questions?
No, nothing's really there. Most of the questions coming through, I've just asked if everyone can reach out to their recruiter.
Yeah, we definitely got vacancies in A&E, which is our emergency department.
Hi, how long do we have the training period, like supernumerary?
Yeah, each area will be different, but we offer a very comprehensive orientation, supernumerary and onboarding procedure, especially for the new build. We've got a big rollout of training days for the CSB building because everywhere, our ED, our ICU, all those areas that are existing in our current hospital are being moved to the new hospital. So there's, big pathways in place to be able to support you from going from the current building to the new building and also onboarding you. So we offer orientation days, we offer supernumerary days, and then go ongoing clinical support from our education team. So you're not left by yourself. Canberra Hospital has a strong emphasis on education, training, and support in the workplace.
And there's a couple of areas that run foundation programs as well. So it might be our operating theatres, they run a foundation program for predominantly new grads, but might be for some people who have not been in that space for a little while, and it's a rotational program where you rotate sort of throughout all of the areas within peri-op. ICU run a foundation program along with ED, so it's really just a supportive program around development of skills or brushing up on particular skills along the way.
What is the hospital bed capacity?
It depends on what given day, but we would be looking at about 700 at this point, and then we go into the new build, so there'll be a slight increase in that.
I think some nurses were asking if they have to come over on the 482 visa because they don't have their AMAC, would they then be able to be supported for the 186 visa afterwards?
Again, this is just general advice. We're not migration agents, but there is pathway for candidates to do that themselves within the 482 after a certain amount of years. So that's something that would need to be explored at a later date.
Is there any vacancies in medical ward?
We're not currently recruiting to the medical unit through this recruitment activity.
Okay.
Hi, I would like to ask, you said the staff patient ratio is like 1:4, isn't it? So is
Yeah.
that all level 3 patients or level 2? It's like mixed. I don't know.
I think we might class it a little differently here. So all our patients in the clinical areas, so our inpatient units are 1 to 4. Within those units, we do have HDU, so high dependency units, where the ratios would change. It will either be 1 to 2 or 1 to 3, depending on the acuity of that patient.
And part of the new enterprise bargaining, which we are currently negotiating, is a rollout of phase 2 areas. So that includes maternity, pediatrics, ICU, ED, where it's proposed that we'll be setting ratios in all of those particular spaces also including peri-op. What's the current ratio that most of you are working under now? What would that be in an acute ward area?
It's 1:1 here in the UK if the patient is level 3, and if it's level 2, 1:2.
Yes, that's
okay, so
within
you're
our
thinking more of an
ICU.
ICU scenario where it is 1:1 if it's an intensive care patient. But then if they're within ICU and decreased to like a high dependency patient, then it's 1:2.
All right,
So,
that's
yeah,
great. Thank you. Yeah.
the 1 to 4 is in the inpatient unit, so the orthopedic unit or your
Oh,
plastics unit. Yeah.
okay. Thanks for that, Kelly and Catherine. Yeah.
How many beds in ICU? Currently 28 beds. There'll be a slight, actually no, they'll go over to the new build at 28 beds, and then out years it's projected to increase the bed numbers.
Any other questions that Kelly or I can answer for you?
I don't know whether this is a relevant question or not. Is Canberra so expensive? I don't know. Just asking.
No, that's a great question and a very important one. So the cost of living,
Yeah.
like everywhere, has gone up, but I think it's comparable to other areas within Australia. Our rental
Okay.
market has definitely improved. This time last year, it was a bit tough to get rentals, but we have seen an increase of rental apartments, properties that are available at the moment. As part of our recruitment, we give you a priority letter that you can share with real estate agents, and we have found that it's been working quite well. We've had a lot of people come
That's
across.
great.
Yeah. So we've had people come across to Canberra Hospital already and started in the clinical areas. They've come from the UK, they've come from New Zealand. Most are finding accommodation before they get here, which is great. So we're able to support you with that through our unit, with the rental priority letter, and also just a list of where like some sites to have a look at rental apartments. We are developing a welcome pack, and in that would be information about what you need to do to relocate to Canberra. So schools, where things are, major shopping centres, just the support you need to get you across and just make it a little bit easier. We do understand that this is a big move. This has a big impact for you and your family, and we are really working on providing the most support we can.
Thank you so much. Thank you.
There was a question there in relation to the number of ED beds that it's kind of a little bit difficult to describe, but we have an acute area which is probably about 25 beds, I think, is it, Kate? We have resus, which is 5 beds. We have obviously our triage. We have a fast track area, which is about 11 chairs in that space. We have a pediatric bay, particular pediatric space, and going into the new build is a lovely big space designed specifically for pediatrics. Then we also have our emergency medical unit, which is our EMU, we call it, which is also 12 beds, where patients will come in for that sort of short stay, 6, 7, 8 hour stays. They'll be transferred out of acute into that space. And then obviously our triage area. So all up, I think it's around 70. But I'm just trying to remember, and I'm trying to count up the beds as I'm walking around the emergency department. But it's, in my head, but it's around 70.
The nurse-patient ratio in ED, if you're working in acute, it's 1:3. Of course, if you're in those high acuity areas of resus, it's the 1:1 and you're part of a team. Fast track, I think it's 1:3 or 1:4, I can't remember, but there's a lot of nurses in there to be able to support you. With the ED, one of the great things is the career progression. So you can come in as a registered nurse level 1 and then work up to doing things like being in triage, being in resus, becoming a level 2. We've also got the advanced practice nurse and the nurse practitioner roles within that area.
And then we have also clinical navigators and unit navigators across the organisation. And part of the other part of ratios as well is implementing team leaders. So each of the surgical unit, each of the acute wards that currently have ratios, it's wonderful. But we also have a supernumerary team leader who for evenings and morning shifts in conjunction with our CNCs, who are our in charge nurses, but they're also our team leaders. So they're supernumerary and they're able to provide that support and assist with coordination of patient flow and discharge planning and things like that as well. That provides that additional resource.
I just saw a question about the 12-hour shifts in ED. That's not something that we do too often. They're traditionally the 8, 8 and 10 hours.
Someone's asked a question about the weather. Canberra weather is actually beautiful. We actually get all 4 seasons. So sometimes you might, if you go to Melbourne, you'll get all 4 seasons in one day, but we get a very clear, distinct summer, autumn, winter and spring. So winter, probably you might get a -6 frost in the morning, but sort of top temperatures usually around 12, anywhere between 12 and 14 degrees. And that's like your coldest days in winter. But summer, it could be up to 33, 34 degrees. And they're sort of hot days. We haven't had a very hot summer this year. We're just, coming into autumn and we're starting to get a few days in the 30s, but it's beautiful. And it really is only a couple of hours drive down to the south coast and you're at the beach, which a lot of people do on the weekends. And that's lovely.
I think the major difference for us over winter is that, yes, we will get down to like -5, -6 and have that thick frost, but then you've got beautiful sunny days. We don't have a lot of rainy, overcast days. So even though it's cold, it's fresh, the sun's out. It's okay. Yeah, we're not going to have like the grey skies of the UK on a long period of time. Yeah, we've got that fresh sunshine coming through. Is there any other questions that we can answer quickly here? The maximum temp, okay. And the lowest temp. All right. So maximum temperature, I heard on the radio on Thursday, it's going to be 34 degrees, which is hot. We got down to 15 degrees overnight. So it's still warm. It's still beautiful weather. My kids are outside playing, walking to school in shorts and t-shirt. In wintertime, as we said, it's a little bit cooler by our standards. I work with a beautiful nurse from the UK and she just laughs at me when I said it's cold. But as I said, we've got that beautiful sunshine during the winter. You do get frost on the car, so you've got to scrape it off in the morning, especially after night shift. It's not very pleasant. But yes, you're not going to get that grey, dreary skies. Yeah, it's sunshine. Like we're built around the sunshine. Lots of outdoor activities. If you've got kids coming across, it's great. Canberra's got lots of parklands, lots of outdoor areas for your kids just to run.
Yes, I've been here for over 30 years in Canberra as well. So I've raised my family in Canberra and there's every single opportunity possible. If the academic, then there's some fantastic schools in Canberra. I've got a lot of friends whose children were extremely academic and have done extremely well with all of the opportunities. Mine, on the other hand, were more sporting aligned, and they had all sorts of opportunities with all of their sporting things that they wanted to do. My son was into cricket, so he had a lot of representative cricket throughout his growing up childhood. But there are lots of sports activities for the kids to be involved in through school or through other local sporting clubs throughout. There's activities, there's clubs and support networks for pretty much everything in Canberra.
Yeah, it's great. We've got great public schools. All my children go to public schools and we're really happy. We've also got the private schools as well. So there's lots of options. There was a question that popped up just before about perioperative services and what we're recruiting to. So we're looking for anaesthetic nurses, scrub scout, and PACU, so post anaesthetic care unit. There was also another question I saw about childcare. Childcare in Canberra, we have lots of options. There's lots of sort of daycare centres in the suburbs. There's none that are sort of connected to the hospital. There's one within the suburb of Garran, but it's not in the hospital, but very close, part of the campus. Again, if you're looking for childcare, we're happy to send you links. Sorry, what?
And there's a lot of if we're at school ages and things like that, there's programs that are called before and after school care as well. That is also accessible.
There was a question about postgrad qualifications for ICU. No, that's not a mandatory requirement. How often is the salary increment? So the salary increment, I think it's a little different than to overseas in the UK. So we have registered nurse level 1, which I think is a band 5. And that goes up to a year 8. That's that top of the increment level. And then you get to apply for a position or a personal level 2 position, which is your band 6. And that will go up to a year 4. And again, you've got the career progression through that as well to your level 3s, which are more support staff and non-clinical roles.
Or advanced practice roles at level 3.
Any options to join as a clinical nurse? I'm not really sure. We're looking for all the clinical nurses. If you can just clarify that question.
There's a question about personal leave and annual leave entitlements in Canberra.
Yeah. So if you're working a full-time rotating roster, you get 7 weeks of annual leave. It will drop down if you're not doing that shift work to 4 to 5. We also have a lot of public holidays in Canberra, so if you're clever, you can put them on like certain days and get extended time off. So our leave is really supportive. We've got carers leave, we've got personal leave as well, and then also our annual leave.
And if you're working full time, you get an accrued day off per month as well.
Yes, I forgot that. Yes, that's a great little bonus.
There's a question about whether a postgrad is mandatory for ICU.
No. Desirable, but not mandatory. Have we missed anything?
No, not that bit. All the questions that are coming through about visa sponsorship and when the interviews will be, just reach out to your recruiter, please. If we can just keep these specific to Canberra and the hospital, or other recruitment questions can go to the recruiter.
Right. I think there was a question about anaesthetic training. We're looking for skilled staff to come across sort of to hit the ground running in these key clinical areas. So we do expect you to have a certain level of clinical skills, expertise and knowledge within that area. So if you're looking at becoming an anaesthetic nurse, we would want you to have the skills before you arrive. But we still offer that education, orientation, supernumerary and ongoing support. Have we missed anything, Lara?
Someone's just asked
how many? I think it's how many days off per week? then you would get 2 days off per week, depending on what shifts you're working. Whether if you're working 12-hour shifts, obviously you get more. But traditionally, if you're working 8 hours, it's 2 days off a week, and then every 4th week you'll get an ADO, which gives you 3 days off.
And someone's just asked about maternity leave.
Yeah, so you need to be with the organisation for 12 months, and then I can't even remember what the leave is. It's good though, and it just continues to improve. So I think when I had my babies, it was up to 16 weeks. Kelly, do you know what it is now? I'm sort of out of that
I think it's
space.
actually gone up because earlier this year there was an extension of the leave period, because I know that we had a lot of staff chewed back, and all of a sudden they rang up and took some more leave on top of that. And you have the ability to take it at full pay or half pay as well, so that you can extend it even further. But I'm sure it's 16 weeks, but there was another extension on that, which is it's another 6 weeks. So therefore, if you take that at half pay, it's another 3 months.
Yeah.
That's all the questions.
Right. So we are recognising the skills and expertise of people that are coming across. If you've done registered triage or resus courses or any courses through ICU and perioperative services, we would be looking at them. You might need to do a bit of a refresher with our clinical educators, and then, yeah, we would definitely acknowledge the skills that you're bringing and work towards putting you into those spaces as soon as possible.
But if anyone does have postgrad quals, we do offer a qualification allowance. So depending on the level of it, it's up to 3.5%, I think it is, for your qualification. So your 3.5% is really like a master's, but your postgrad cert or diploma, it's also considered.
So there's a few questions coming through about when you would know if you're successful. We're hoping to be able to generate you an offer on the day of interview.
I think that's all the questions now. If anyone's got any more questions regarding the interview dates and application process, please reach out to your recruiter. But thank you everyone for joining us, and thank you Kate and Kelly for presenting today. We do appreciate your time.
Thank
you. Thank you
It's been
everybody for
great.
coming.
Yeah, please
And I
reach
hope
out.
Okay.
I was just going to say, please reach out if you've got any other questions. And yeah, I look forward to seeing you in person.
And I hope to see you when you come to Canberra.
Yes.
Kate will be going off doing all of the interviews, and I'm hoping that we will be able to meet you all in person in the coming months when you come to join Canberra Hospital.
Great. Thank you so much, everyone. You have a good day.